Well, you made it to the last session of the day. We appreciate your attention, and we do think it'll be a great one here. I've got three great employers here with a lot of innovative ideas. So we've created a bunch of questions and different topics that we've been discussing with plan sponsors as we've met with them this year. But if you have questions, please do wave your hand. We'll have a period of time at the end to be able to get some insight from each of them. So. Brandon, I'll start with you. If you could just tell the audience a little bit about yourself, your role, your company, and go from there.
Thanks for having me. Brandon Speck, work locally here for the Timken Company that's headquartered in North Canton, Ohio. So my role within the Timken organization is manager of benefit strategy and design. So essentially I have responsibility domestically and globally for the strategy and design around our health and welfare plans, our well-being programs, and our retirement plans. A little bit about the Timken Company. We are a 120-year-old manufacturing company that specializes in engineered bearings and industrial motion products. We span over 40 plus countries with about 19,000 associates or employees in total across the entire organization. 7,000 of which are situated here in the U.S.
Great. Jessica?
Hi, everyone. Jessica Ward. I'm with Designer Brands, which is the parent company for DSW, and in Canada, the shoe company. We are also a designer and sourcer of other designs of shoes. So Keds, Lucky, Jessica Simpson, Vince Camuto, just to name a few. So thanks in advance if you are shoe lovers out there. We have about 14,000 associates across the globe. About 12,000 of them are stateside, and of those, about 3,500 are benefits eligible. I've been with Designer Brands for about 9 years now, and I oversee our benefits, HR technology, and payroll.
Thanks, Jessica. Rochelle?
Hi, my name is Rochelle Firestone. I work for the Kenan Advantage Group, local here in North Canton. I am the Director of Benefits, so handle all of the benefit design, implementations, and the 401k plan. We've got about 9,000 total employees. 7,000 of those, or 7,200, are here in the U.S. And the Kenan Advantage Group is the largest bulk tank carrier in the United States. So we haul several different platforms: food, chemicals, merchant gas, and fuels.
Thank you. First question. So all three of you have kind of unique and diverse workforces, and they're diverse not only in the types of people that you employ, but also in the jobs and the functions that those individuals perform. Jessica, let's start with you. How has Designer Brands kind of reached and engaged with those working in offices, to your warehouses, and then your more than 500 retail stores across the country?
Thanks. Communication is a challenge. I'm sure in every organization you all face your own unique efforts to get people to pay attention to their benefits. We really have taken a very targeted marketing approach to our benefits. So when you think about benefits and how much we invest in our employee benefits, we often don't invest a commensurate amount in our communications. So we have gone, still on a shoestring budget, to targeting email communications. We spent a lot of focus on sending direct to personal email accounts, which I know in some organizations that might be a little bit outside of the normal course of doing business, but for us, a very small portion actually has a corporate email address available to them. We also use things like mobile wallet card. I think a digital wallet card was talked about earlier today, which is a great way for both our full-time and part-time associates to have access to all of the benefits that we have available throughout or without being behind a firewall. And we have a very targeted benefits newsletter that we send out each month. It's not your average benefits newsletter. I will say it is one of the more fun newsletters I think I've ever seen. Last month was May the 4th be with you, and it really gets people's attention. There's really great theming that goes throughout and keeps people engaged. So we do that. We focus on mental well-being a lot within our organization, and we've created a lot of brief resources as well as some really beautiful communication materials, both written and digital, that we send out, and we consistently get a lot of great feedback. We also do some benefits questionnaires that we build into our newsletters just to see how we're doing. We get a lot of great feedback from our associates, and even have started to look at Net Promoter Score to see how people are feeling about us. So those have really helped us to engage with our associates in all the different locations.
I enjoyed the shoestring reference. That was good. Brandon, so Timken, you've got everything from engineers with PhDs to production and maintenance employees. And so how do you kind of tailor your messaging to really a very wide audience?
Yeah, sure. Well, I think first and foremost, we try to keep the messaging the same, so that whether it's that engineer with a PhD or our C-suite or that operative, worker down in the Carolinas, they're getting the same message. So everybody's hearing the same thing. What we really try to do to differentiate is the modalities in which we communicate. And we could step into a manufacturing setting and pull 5 people, and somebody wants emails, somebody wants a flyer at the plant, somebody wants an app. So we try to hit a wide range of modalities to make sure that we're reaching our people. I think one of the more interesting tactics that the Timken Company has taken, especially in our world headquarter facility, because we are not fully remote, we're still in the office. Obviously, our operative workers are in the plants. One of the things we do that we whimsically call our bathroom briefings. And there was a lot of statistics here today. I love statistics. So an interesting statistic that I found just recently was that the average American worker spends 14 minutes a day in the bathroom. So why not bring the communication to them? Maybe a little bit invasive, but we know that people spend time in there, and maybe some people spend a little too much time. So bring the communication to them. So that's kind of a fun little thing that we do, and fortunately still have the approval to do that. And secondly, a really cool project that we're working on right now within our team is a thing that we call Timken TV. And what we're essentially doing is we're deploying media players out to all of our plant locations that will hook into the TV that we can control centrally from world headquarters that pushes our benefits content. And it's really nice because we can have streamlined messaging across the entire organization, or if we want to target something very specific to a certain plant, we have the ability to do so as well. So really focused messaging, bringing the message to the people while they're on their lunch break. Maybe it's a different break or before or after shift. We're able to put some nice digital images, videos, things like that to help keep our people all across the U.S. at least engaged.
Great. And Rochelle, finally, the trucking industry, right? So
Yeah.
how are you navigating?
Yeah. Well,
that whole
Jessica's population, 85% of ours are drivers, and they do not have company emails. But about 2 years ago, we introduced a new HRIS system, which has a lot more information for our drivers. So we do have all of their email addresses, personal email addresses. So we do utilize that. New technology in the trucks, they have their pads, their iPads, tablets, and then they have Qualcomm. So they log into their trucks, each driver with Qualcomm, so we can message across Qualcomm. We also have TVs, as Brandon was saying, in all of our terminals, and we have deployed those and used those before. But we found that email is the best way to reach email is the best way to reach our drivers. Text messaging, they text message with our benefits team on different things, but usually it's email. We know we can reach them by email.
Not while driving.
Not while
No
driving.
texting while driving.
No. And we can't do the bathroom thing because our legal counsel says no. We tried.
Bathroom postage.
The bathroom posting, yeah.
Yeah, probably less smartphone usage, I would assume, than most populations. So each of you have done various things to kind of take some risks and be innovative at your companies. Can you tell us why you feel that that's important to kind of try to be, pushing the envelope and try to coming up with unique situations and things like that as you navigate benefits? And let's start with Brandon this time.
Yeah. I think more than ever, I think everyone sitting in the room can understand that taking risk, being innovative it's pretty much the norm now. I look at the Timken Company again, a 120-year-old company, manufacturing company. Some of the things that we have been able to do over the last couple of years, I think, 5-10 years ago, if you would have taken some of these ideas to our C-suite, the response that we would have gotten is, it's only those large tech firms that are implementing those kind of things. We're not here, we're not there yet. But with the attraction and retention issues, all across the globe, with remote work, so you're not only, the Timken Company World Headquarters, we're not, only fighting for talent, around here in Stark County. You're fighting for talent all over the place. It's really important to increase that employee value proposition. And, some of the things that Timken has done, I look at some of our kind of bolt-on point solutions that have been pretty innovative and things that, we're targeting specific needs like, Averta, specifically for us, Averta for diabetes, or, implementing Noom, which, everybody has heard of Noom, probably watching TV, or, if you're, listening to music and an ad pops up. We've had some really, really great feedback around some of those type of programs that we're bringing to our associates. One of the most recent things we've done is addressing a need around financial wellness and financial stress. Was we implemented a solution called Pay Active, which is an earned wage access program that essentially, it comes with a suite of financial wellness tools, but it ultimately gives our employees access to a portion of their paycheck prior to payday. And it's not a loan, it's not an interest-bearing loan or anything like that, but we identified a need that a real-life example was, somebody couldn't get to work on a Thursday because they didn't have gas in their tank, and they got paid on Friday. So how can we, just get people to work? So being able to implement a benefit such as, an earned wage access program to help ease some of those, maybe smaller financial burdens, has gone a long way. We implemented this in, it was about mid-January, and pretty astonishing. We have over 300 people that have enrolled in the program, and just over $300,000 of earned wages have been accessed since mid-January. So definitely, a benefit that we're seeing a lot of use out of, and we address the need. So it's pretty positive for our workforce.
Yeah, that's a really neat idea. Jessica, how about you?
Yeah, I echo a lot of what Brandon has said. I think we have tried to invest in innovation that makes the most sense for our population. We talk about point solutions. 20 years ago, there were no point solutions. In the last 8 years, there has just been an explosion. So finding the right point solutions that really match our team's needs. And for us, we are about 70% female. So we've really invested in women's health. And we continue to expand in that space. We have added in a lot of fertility support, really end-to-end maternity support, and our leave of absence programs, parental support, have been continuing to expand both in the way we communicate and educate and engage with those associates as they go through that leave process and return to work, as well as just helping them as they are going through that stage of life. Most recently, we are undertaking a pilot with a new vendor that is really new to the space in migraine health. And so we have seen that it is really, it's an issue that our associates are not getting treatment for, don't know where to start, don't have the right support tools. And we're really excited. Our pilot, we sent out a couple of communications and it instantly filled up when we sent it out in a targeted fashion. And we're already hearing really great feedback and significant reduction in migraine days. So we're excited to see how that plays out. And we'll continue to invest in those areas where they make sense and really can deliver value to our associates, because we have a finite amount of brain space that we can get in front of people when it comes to communicating our benefits.
Yeah, it's all about picking your spots. And Rochelle?
Interesting. It's kind of tough to do anything innovative just because of the population and the drivers that we work with. We've got about 1,500 drivers that are age 60 and above. And when you consider, that you've got almost 6,000 drivers, that's a very old population. So just the things that we've that we've just come into technology. So the usage of their online benefits system, the tablets in the trucks, the lytics systems, all of the things that their trucks now talk to them. They automatically brake for them in situations. So that's kind of where we've been. We've always offered our driver advances on their salaries. That's a normal thing that we do. It's supply and demand and economics on drivers, or there aren't many drivers out there. So we're very specialized transportation, so we need people with experience. So we've just kind of bring them along slowly. They're definitely getting there. They all use the computer now, so.
There you go. Hey, YouTube and TikTok could be next.
Yeah.
So you
Oh
never
no,
know.
that's just Ralph.
That's great. So I am happy to say, and I'm sure you've all seen in the headlines, but the public health emergency is ending tomorrow on May 11th. So I'm curious to get all of your perspective on kind of how you're going to handle testing, things like that, kind of moving forward, things with the vaccine, and if anything's changed. So I'll start with you, Jessica. How are you looking to cover testing kind of moving forward?
Sure. We actually just sent out a communication to all of our associates, letting them know about the changes that were occurring. We have communicated that we'll be ending over-the-counter testing coverage in our plan. We did emphasize that it is still an FSA-eligible benefit, and for all diagnostic testing, that will be going back to a co-insurance deductible process. And then we have extended provided really detailed outline of all the changes that are occurring in terms of the end of the never-ending claims deadlines. So those have just gone out. It's really quieted down. We have not really heard much in this space. Obviously, we're still monitoring some of the states like Colorado and New York that have other obligations around COVID pay. So we're continuing to monitor those, but we are definitely seeing a wind down occurring. And vaccinations you asked about, that is going to be preventative as well.
Great. Rochelle, you want to?
We're going to continue all the coverage as we've done through the pandemic, at least for now, through the end of the year. Our C-suite wants to see what might happen, but we just don't want to yank it away just yet.
Great. Brandon, some more for you?
Yeah, so similar comments, obviously, to both of you. And the one thing that you didn't mention, so I guess I will, is around the telemedicine coverage. So we're extending that on our high deductible plans through the end of 2024, which obviously will be a positive thing for our members.
Yeah. Absolutely. I think the last piece on that, are there factors that you're still considering or that have changed since the pandemic? So whether that be flex time or kind of more of the work at home, kind of the hybrid, things of that nature that really sort of seem to arise out of the pandemic. Are those things that are kind of being considered a little bit more by you all or not necessarily?
Want me to start?
Let's start with Jessica.
All right. So I will say, yes, we are also providing telemedicine and continue to cover that at no cost. With the telemedicine specifically, we also had virtual visits available. Over the pandemic, we added mental health, and we have had really great reviews from our associates in offering that coverage. All of our teledoc coverage is offered at zero copay, so we really encourage our associates to use it, and they use it very actively. For us, we had three categories of things that we really evolved. So we are fully embracing work from home where it makes sense. Obviously, our stores and distribution centers are our frontline workers, and we value them being in those facilities. But for our corporate population, we have really gone to a work from home strategy across all of our population, and that's worked really well for us. We continue to monitor that, but I'm a prime example of work from home as I have moved out of state, but my team is working well there. We also embraced PTO for all associates. So in the last few years, you've seen an uptick in legislation around sick leave, and those sick leave policies were impacting about half of our population, and we really felt it was important to support our associates and give them time off. So all of our part-time associates now earn PTO, which it is a huge portion of our population. So that was a really big investment for the organization. And then we've invested a lot more in mental health and well-being, as well as increasing our bereavement policy. And we really expanded both the definition of bereavement, eligibility of a loved one, as well as the number of days that we cover as well.
Rochelle?
I forgot the question.
Just are there other factors through that?
Sorry. So KAG we're an essential business, so we've never missed a beat really during the entire pandemic. But in the field, we are 24/7 operation. Consequently, there's no work from home. It's just work. At our corporate office, we do a hybrid schedule. Employees, depending on what their job is, can work from home 2 days a week, but must be in the office 3 days a week, which is kind of a concession because our senior management really is, you got to be in the office we're trying to get them to shake loose a little bit, but it really just affects the corporate office because in the field, our drivers can't do their jobs from home.
Brandon, anything to add there?
Yeah.
Yeah, I mean, similar to Rochelle, you know, we can't make bearings, you know, sitting in your home office, right?
Yep.
So we have adopted very similarly a 2-day work from home policy. I think the one thing that Timken does, which, you know, to be quite honest, I was skeptical of at first because I just didn't really understand why, but I get it now, is 2 days from home, but those 2 days have to be taken either on a Monday, Wednesday, or Friday. And, you know, the reason behind that is it definitely promotes that cross collaboration, networking, in-person meetings on those Tuesdays and Thursdays, which I think is beneficial for the organization. You know, the work from home is great. You know, Timken, one of our core values is teamwork. And, you know, I look at it as we're trying to navigate the remote work landscape because, you know, when you look at the workforce nowadays, especially the millennials and the Gen Zs who really focus on that, you know, we can promote, well, there is a work from home policy, but the majority of our workforce has to be, you know, in the plant or, you know, in the office at the plant working. So, you know, we'll bring that teamwork in a sense of, you know, we're going to do the same. Obviously a little bit different because we do have a policy at our world headquarters, but I think it's a good policy that promotes that teamwork and collaboration.
Great. So Jennifer gave us a lot to think about from a mental health perspective earlier, and one of the statistics that she gave that was astounding to me is that still 75% of companies feel that there is a stigma attached to talking about mental health, and it was from 2021, I believe. Rochelle, are there things that you've done that you're trying to be not only innovative, but just more kind of putting it in the forefront of the mentality and making it available, especially in an industry, I imagine, with an older population?
Yep. Yeah, I think one of the things, and she also hit on that during her presentation, is our CHRO, Ralph Lee, has finished the DE&I and culture training so that all of our management across the entire U.S. understands what our culture is, what we represent, what they need to be doing. So we have done that. We also promote the EAP that we have, guidance resources, and our regional HR managers are very heavy into making sure that they have all the brochures, that all of their managers, their terminal managers that they're responsible for have those. When a manager talks to HR or to the benefits department, and they have an employee with an issue, one of the things that we actually kind of require them to do is reach out. You're required to reach out to the EAP. We don't want any information. They just verify that the employees reached out. That kind of helps them with whatever issues, and it's usually some type of issue at home that they're trying to deal with. But I mean, those are kind of the things that we have done. We've used the EAP for boots on the ground for grief training. We've had over the years several drivers that have passed away in accidents, and it hits those terminals very hard. And then also during the pandemic, we lost 17 drivers to COVID, and it was actually really rough. So that's what we use usually.
Jessica, how have you?
We have done several different things. In 2021, we offered mental health first aid training for our HR business partners. And that really was an impetus for additional interest and engagement in all of the offerings that we had around mental well-being. And since then, we have conducted quite a bit of manager level training. In fact, this month we have planned trainings again scheduled for our distribution center managers and for our market leaders for our stores to really help them, not in so much being full mental health first aiders, rather just knowing how to engage and have the conversation, ensure that they know what resources are available. So we've spent a lot of time with our newsletters, special communications. We've leveraged things like, obviously right now is Mental Health Awareness Month, and we've had World Mental Health Day in fall. So we just have continued to invest in it. And like I mentioned before, we added the telemedicine component for truly that one-on-one virtual mental health counseling. I noticed that Jennifer mentioned earlier about guidance, and I think you just mentioned
Guidance
that as well.
resources. Yep.
We retitled our EAP Counseling and Support, and that really seemed to resonate with people differently and took away some of the stigma as well.
Yeah, I mean, very similar comments. We also renamed our EAP here in the U.S. as the Work-Life Balance Program, and kind of ironically, we're having this conversation today. Pretty exciting news for the Timken Company. On May 1st, we launched our global EAP to all of our associates outside of the U.S. So it's been a pretty exciting month from that perspective, getting the promotion out. And I think it starts with leadership, right? If you have leadership buy-in, our CHRO put out a very nice email and a very nice message within the Timken intranet, promoting, the U.S. piece, the global piece, which was really positive news. And one of the things that Jennifer was talking about, which I was excited to hear her talk about, during May right now, there's 5 weeks, there's 5 weeks in May. We have 5 ERGs at Timken. We have the Women's International Network, Multicultural Association of Professionals, the Young Professionals Network, Timken Pride Network, and Veteran Engagement at Timken. And each one of those ERGs has a specific week during May to have different activities, different speakers, and we're interjecting some of our material for our U.S. Work-Life Balance program, engaging with our vendor on that side, to send us swag that we can pass out, just little trinkets that have the number on it, have the name of the program, just to keep people thinking about it, right? And the more that people think about it, the more they become educated, they become empowered, and hopefully, we'll utilize the services because they are a great benefit.
Yeah, keeping it top of mind. Let's pivot here to some of the legislative things that we just heard from Garrett and Madison. Of course, each of you with employees across the country. So some of this legislation, as it goes state by state, may impact you a little bit differently. Are there things that you're thinking about administratively just to communicate those changes? Are you going to take kind of more of a uniform approach? Is it going to be a situation where you have to deal with them each as they come? Are you putting it on the back burner and waiting to see with more of an approach that way? How are you looking at it, Brandon?
Well, I think first and foremost, at least from my perspective, we're going to have to stay pretty tight with our employers' health team and our CVS team to truly understand, what's going on and how, Timken should respond. I think a case-by-case basis, waiting until guidance comes out that we're fully up to speed, of what's going on. And obviously there's no shortage of, interesting topics that Madison and Garrett talked about. One of the things that I'm really interested to see and maybe not interested to see how it plays out is, from a commercial market perspective, what's going to happen to plan sponsors, right? Are these, potential increase in drug costs going to come down to, to the plan sponsors, to the members, and how, really, how can we communicate it? And that's a big thing with our population is as these things happen, our population is really curious as to, why are you doing this? Is this the company doing it to me? So we have to be, careful but informative in those type of communications to make sure that, our members understand, they're comfortable. And I think, again, it starts with, working with your organization and our PBM to make sure we understand what's going on.
Just
Yeah, I echo similar sentiments. I mean, for us, I think we don't want to make any knee-jerk reactions. We definitely are closely monitoring. That was very interesting about the J&J versus Save on SP. We knew that was coming at some point, and we're riding that train as long as we can, I think. But I think we have taken some proactive steps as needed. For instance, last year when Dobbs was being evaluated, we did take the step to make a very comprehensive decision around our medical travel benefit, and we really expanded it to all eligible services within our medical plan. It was very appropriate to our culture, and we were able to provide that in advance of any of those decisions being made. So that was really well received by our associates, because we do really focus on doing the right thing and taking care of our associate population. It's definitely going to be an interesting ride to see how ERISA may or may not be preempted, and could continue to change our landscape.
Yeah, same here. We're kind of doing what Timken is doing. We're kind of just taking it case by case, kind of sitting back. We don't have very many employees in Oklahoma right now, thank you. But yeah, fingers crossed. Who knows where it'll hit next? But yeah, we're just kind of waiting to see. I know that our senior management is really concerned about where all this is going. A lot of this is not going to be sustainable for companies, plan sponsors.
absolutely. Let's talk a little bit about the GLP-1 drugs and weight loss. As we've gone out and we're meeting with people looking at their 2022 data, we're seeing a lot of this claims utilization across the coalition. And when I'm talking about those GLP-1 drugs, we're talking about the Ozempics, the Trulicities, Rybelsus, those types of medications, and then into the weight loss when we're talking about Wegovy and Saxenda and how those are being treated. So I'm curious, first of all, just to talk about, what are you hearing from your employees? Is it a banging down the door? Hey, I need to get my Ozempic to be able to curb my weight loss, and perhaps being used off label and things of that nature. So what are some of the things that you're thinking about? And I'll start with you on this one, Rochelle, to see if...
Yeah, that's interesting. I did hear from two particular employees that were complaining about it, and it's like, get out of here. You're talking to the wrong person. But we did start covering weight loss drugs under our plan the beginning of this year. And interestingly enough, I was talking to Jessica, the number of bariatric surgeries for some reason have spiked this year under our plan, which for us is a good thing, because our drivers they can drive 13 hours a day, and that's a lot of windshield time, a lot of not movement, so they weigh a little too much. So, but it has been interesting, we did hear from people when we put that in place.
We are in the midst of implementing the GLP-1 clinical.
Smart Edit.
Yes,
Yeah.
thank you. Thank you. That is what I was looking for. So with that prior auth, that will go into effect on September 1st. But when we were looking at our statistics, it's still a fairly small population. We made a specific intentional decision to pause and not roll it out immediately, just to give people enough time to communicate with their providers and their pharmacists, make sure that those that needed to have coverage got all their paperwork taken care of. I am sure we will hear once we put that edit in place. In terms of the weight loss drugs, we will be having conversations with our team at Employers Health and CVS in the coming days, actually.
Yeah, and the smart edit that you referenced, and then I'll hear from you, Brandon. Really what that's doing is looking back into the claims data to see if the individual that is taking the Ozempic or the Trulicity is actually taking it for a diabetic diagnosis versus just using it on the weight loss side of it. Really, the Wegovy's and the Saxendas are the ones that are supposed to be intended from the weight loss perspective versus the Ozempic and the Trulicity. And what a lot of plan sponsors are seeing is some of that off-label utilization of the Ozempic and the Trulicity. So they're showing up to talk to their doc saying, hey, I saw this great drug. It's marketed all over TV. Maybe my son showed me an ad on TikTok, wherever it is. I got to get this drug. How can I get my hands on it? So it's finding ways of thinking about that. And of course, obviously, these are very sensitive topics because the medications have shown that there is some efficacy there. So how do you tie that in with wellness and the other initiatives that you have as an employer? So, Brandon, anything to kind of add on that front from what you've heard?
Yeah, and I mean, I think the last statement you made is, tying it in with wellness is key. Fortunately, I would say for Timken, we haven't heard much. So apparently our employees aren't scrolling through Instagram and Facebook, because when I do, that's about all I see. And celebrities talking about it. So I'm sure it'll gain traction here soon. But I think some of the things that we've talked about within our team, and it sounds like some of these strategies may be coming to light, is, okay, if you're going to offer weight loss medication, what type of PA or step therapy could be in place, and really looking at lifestyle management. So are there lifestyle management strategies that a person has to maybe interact with a dietitian or a health coach for a certain period of time before they can be prescribed the medication, to see what type of lifestyle changes can impact a person's health. We promote heavily. We do have a wellness program called the Better Health Program, and there's a couple different requirements. One of those is obviously getting your biometric screening done, submitting that to our wellness program provider. But we take it a step further, and we actually we look at 5 biometric values, and in order to essentially earn the incentive through the wellness program, you must be in the healthy ranges of 3 of those 5 values, or improve year over year by 3% in 3 out of those 5 values. So, we've kind of been in the camp already that we're trying to promote those healthy lifestyles, whether it's through, dieting, on-site dietitians, on-site fitness centers, to promote that healthy lifestyle. But I do think that, this is, it's definitely a topic of conversation amongst, our team, and will continue to be.
Jessica, have you seen anything on the medical side similar to what Rochelle mentioned with the bariatric surgeries? Anything like that in your data so far that causes you to be thinking about it?
So at this point, we do not cover bariatric surgery within our plan. It's been a topic of discussion for the past few years, but it has been a decision we haven't yet landed on.
So let's move to gene therapies, biosimilars, some of the things that were discussed a little bit. A lot of these medications that are coming out onto the market have an extremely high cost. So the question for a lot of plan sponsors is, how's that going to be covered? What are some different payment strategies? And at our conference back in March, we kind of talked a little bit about some of that risk pooling and things like that are being offered by, some of these manufacturers and things to try to cover some of these very expensive medications. Are there anything, Brandon, I'll start with you on this one. Are there newer things that you guys are thinking about at Timken, kind of strategies that you're trying to put in proactively before one of these might hit your plan as you consider more coming down the pipeline in the coming years?
Yeah, I think we are, we're looking at, different utilization management strategies and making sure that we have, the right clinical strategies in place so that the people taking these medications truly need it. But, one of the things to talk a little bit about when you talk about gene and cell therapies, I mean, I would say that we haven't probably done as much as we should, as of yet, because we know that these they're coming. They're coming quickly, and they're very, very high cost. Some of the things that we've started to look at is carving out, gene and cell therapies, carving out the network, different, contractual language or value-based contracting, to, help, not only, kind of make sure that we're incurring, maybe the lowest cost possible, but that our members are getting, the right care at the right place, whether it's through a COE model, covering travel, whatever it may be, just to make sure that we have, the necessary items in place, contractually, from a stop loss perspective, that we can manage this type of drug spend.
Rochelle, I'll come to you next.
Yeah, we're doing the same thing Timken is right now, although one of the first 2 gene therapy drugs coming out for hemophilia and sickle cell, we actually have patients with hemophilia. We have 2. So one of the things that we're literally looking at and considering is just totally not covering gene therapy at all. Our C-suite, senior management, has a serious problem with the cost of some of these drugs. Now, what the manufacturers are going to do, we have a 25% turnover rate, which in transportation is actually pretty good, but how are you going to track that person? If they leave in 3 years, where are you going to track them? How are you going to track them? So they're very, very concerned that literally it is not sustainable. And we have, unfortunately, a lot of participants in the plan that have rare diseases. So it hits us really hard, and but we're looking at every angle.
I'm probably more in Brandon's camp here. We have a lot more work to do, I think, in this space. We really need to sit down and think through it. I think there's a lot of philosophical discussion that needs to be had. And we all obviously don't know what the right answer, what the true costs are going to be, and how it's going to impact our total plan spend. So it will be on our radar to spend some time in the next several months.
Okay. Next, anything new or exciting that you're planning on implementing for 2024? Who wants to start? Rochelle?
Well, so far this year, in July, we're putting in Surgery Plus with Hinge Health, which is great for especially our driving population. I actually used Hinge. I used my husband as a dummy for Hinge Health to see, would he use it? Is this worth our time? And I think it actually is. And then Hello Heart, we're going to be implementing. And then we're also starting this year, going into 24, we're going to start doing some road shows. So going to different locations and actually having some one-on-one conversations with our drivers at 4 a.m, I'm sure, because that's when their shift starts, to see, to have that discussion about healthcare. So for us, that's extremely exciting, even though part of it's this year, but there'll be more next year.
Are you waking up at 4 to get the discussion?
I probably won't go to bed. It's probably a better chance of me being awake at 4 a.m.
It's perfect. Brandon, you want to go next?
Yeah. Well, Rochelle, that's a quick funny story. Timken, we're also piloting a couple MSK point solutions, and we just piloted one of them, and a couple different members of our team, and I was all strapped into the device, and I'm laying on the ground, and I'm doing it was for my knees, and I was doing the exercise, and I felt something laying next to me, and I look over, and my 5 and 3-year-old daughter are laying next to me doing the exact same exercise that I was doing. So I thought that was pretty cool. And I'm like, hey, this is a great marketing tool if we ever go to these things. So sorry, quick story. For 2024, I think one of the most exciting things that we are considering and looking at right now is healthcare navigation. And for the Timken Company, it's we've seen rising healthcare costs, and our employees and our families, really need, just like I do, the education around, where to go, where to access care, who to talk to, feeling comfortable to be able to talk to someone about these type of things. And, we've looked at a couple, providers thus far that we're evaluating, and, it's a big price tag. So, there's a lot of eyes on it, right? Our C-suites, looking at it. So makes it a little bit more, interesting and fun in a good and maybe bad way when you're, presenting to that level of the organization about implementing, something that, obviously has some, very potential positive financial outcomes and, clinical outcomes for our people, but also at a relatively, decent price tag. So we're pretty far along in that process, and my team and I and Chris, my manager, and his team, we're all working together right now to finalize our final proposal to take up to the C-suite and hopefully get their approval to implement a program next year.
That's great. We've been using care navigation now for several years, and I do think that it's a great investment. It really does improve the experience for the associate and their family. For us, we are still looking probably to stay a little bit more status quo going into 2024. We are looking at affordability of our plans for our lower income workers. And then we, as I mentioned earlier, we have a pilot ongoing that I'm excited about for migraine health. We will be hoping to evaluate that, make that decision over the summer if we're going to continue that into 2024. But we actually have our joint annual review with all of our vendors, including CVS and Employers Health tomorrow. So I'll be headed to Columbus so that we can really dig into all of our trends and decide if there are any other focus areas that we need to invest in for next year.
Yeah, I think that's a nice segue. We chatted about that a little bit at dinner last evening, and vendor summits got brought up today. Can you talk about kind of your experience with that and how you've brought some of those vendors together and how that's been kind of a collaborative venture for you all?
With our consultants' help, we've spent many years going through, as I'm sure all of you benefits professionals have spent your marathon of 8 weeks of 2-hour to 4-hour meetings with all of your vendors, and at the end you go, what did we talk about? And so it's really nice. We've been doing this for, I think, 4, maybe 5 years now, bringing our medical provider, pharmacy, dental, vision, and occasionally some of our other point solutions into the mix, although they're usually represented within our partners, as well as our care navigation partner. We all come together and we have all of their executive summaries. So it's not we would be there for 24 hours if we had all of their presentations, but we really get to the heart of it. What are the actionable items? And one of the things that we most value about it is that they're hearing from each other. They're seeing where there is overlap. We're seeing where there are gaps. And we have the opportunity for them to then come to us with other recommendations. They're talking amongst themselves and coordinating their conversations. So we find that there's a lot of synergies within those discussions, and it's a great way to see the real what and what actions we need to take by going through those presentations all as a group. So it's very energizing. It's a lot of work. It's big hats off to my team and our consultants to put it together, but I think it's really worthwhile effort to engage in.
So one last question here before we open it up to the audience for some Q&A. What's one thing that you're planning on taking back to your respective teams that you've learned maybe today here at the conference? Brandon, you want to start?
Well, Matt and Courtney, bathe daily. We heard that earlier, so
That's a good one.
That's a good one.
You weren't doing that before, or are we? Is that a new one? Okay.
And Mr. Andy Fastow, get a dedicated a-hole on your team. So two big things that we're going to take back. We're going to work on at the Timken Company. All kidding aside. I really liked Jennifer's talk around mental health. And some of the things that we're trying to do, I think she highlighted around, management training and making sure that our people managers, know the program, know how to access it, and are comfortable talking about it. I read a study, it was a couple of weeks ago, and this number is going to be close, but it was like 78% of U.S. employees put more trust in their manager to deal with their personal issues than they do their therapist. And, I thought that was astonishing of, someone, coming to you as a people manager to talk about, their personal issues and being able to help. So, we have to educate our people managers and get them up to speed and make sure they're comfortable talking about it. And I really liked, to bring back to our team to discuss, again, Jennifer's comment around, don't start with pushing the counseling or the EAP. I mean, maybe small things. And the one thing she said was sleep. And I think that's really important and really impactful that, start somewhere small, get people engaged, let them get a little bit of a feel for it, make them comfortable, and then once they're comfortable, they'll start utilizing, the programs. And within our space, on the shop floor, people talk. People talk about everything. They share a lot of information. So, if we can get people utilizing specifically our work-life balance program, get them talking about it, get them feeling comfortable, I think that'll be pretty positive and make the Timken Company even more successful in the future.
Rochelle?
I agree with Brandon. I think the mental health thing, what I'm going to take back to my immediate team is you're the conduit. So you talk to these drivers when they call in, and a lot of times it's when they're on leaves and they're having issues and they're having financial problems, and just all of the things that Guidance Resources offers are things that can help our drivers. And then pushing up, I think we need to make sure that our C-suite is aware that we really have to start paying attention to the mental health wellness of our population, especially our drivers. It's a very stressful job when you think about that, hauling 8,000 pounds of fuel behind you, and people on the road are not very observant of trucks. So makes for a very stressful job. So I think that's my message to take back to them this year.
I would echo the conversations. I think Jennifer's presentation was really powerful. One of the items that we've been talking about from a total rewards perspective, we're talking about just the theme of resilience. And resilience was kind of within that conversation around mental health. But when you think about it from a financial resilience, a physical resilience, a resilience from a mental health perspective, we have that theme running through, and I definitely, we're starting to try to reinvest in that, and back to sleep and some of these other options that we can really get our associates to engage differently with our offerings. And then the other, I think, more clinical perspective that I want to go back to my team and dig in, learn more about is all of these, like the rheumatoid arthritis and the psoriatic arthritis and all of these clinical therapies that are coming down the pike, because I think that is, I was looking at our pharmacy spend today, and that has continued to rise in our claims, and we have a real need to address that before it gets any further.
Mm-hmm.
Well, thank you. And I know I speak for everyone in the room. We're very grateful for the three of you for putting the time into preparing these answers. You're all juggling a myriad of things, and so we certainly appreciate you taking the time to share your perspective with everyone in the room. So with that, I'll open it up. Are there any questions out there, topics that we might not have hit on that are of interest?
No, they want to go home.
We're standing between you and home.
We're holding you in here for 8 more minutes regardless.
That's right.
So.
Might as well laugh.
So I don't have a question. What I wanted to say is I really appreciate, I've been to 2 different meetings over the last month, social determinants of work and social determinants of health. What are those things that are keeping good people out of jobs? And a lot of them is not having gas to get to work or not having the right health care. So I want to applaud all of you on the things that you're doing for those employees that need the extra help, a little bump. And you're already doing that work. So I just wanted to say thank you.
Thank you.
Thank you.
We done? Commander's?
If I could ask a question to Jessica, one of our initiatives for 2024 is also looking at the affordability of plans for the lower paid employees. I was curious if you could elaborate a little bit more on what sort of solutions you're looking at.
So it's early in its discussion. I will tell you that a couple of years ago, I went to a presentation by another company, and they had actually done 2 things, and it's still, I think, in its infancy and pilot. But one was around looking at their workers under $70,000 a year in income, and looking at offering things that they would need. So to the social determinants of health, they had the option for an account that would help them with transportation, with food, and with benefits. And it was a medical plan that was solely focused on that population. So you could not get into it if you were a higher wage earner. And that really spoke to me, because it was not a high deductible plan, because high deductible plan does not help, right? It helps them if they're not sick, but if they're sick, it puts them further behind. And so really evaluating that, and if we can't do that, what else can we do? We have thought about, I don't want to have this huge chart and hierarchy of how much you make, and it's got 15 tiers and all the different complications of contributions. But we have a large population that is in that 70,000 and under group. How do we make their premiums more affordable with still the same kind of health plans? We only offer two types of health plans. We have an HRA, and we intentionally, when I came to the company in 2014, we intentionally moved to an HRA from an HSA because they couldn't afford their prescriptions on that plan. And so we moved to an HRA that offered them copays. It did actually put money back into the company, and we reinvested that in other benefits. And we offer that and a PPO. And so for those two plans, those really give the associate of how much do I want to pay out of pocket, out of my paycheck, or at time of service. So we would still stand by that plan design while looking at other ways that we can support a more effective contributions cost strategy, because that's what we hear most from our associates is they can't afford it at that lower level. I will just say, just as commentary, I think it will be interesting to watch over the next 12 months as Medicaid redeterminations really take effect. I think that is going to, we have seen our enrollment percentage dip in the last few years, and I suspect it will rise again once those Medicaid redeterminations come in over the next 12 months. So that will be something for us to watch as well.